Well, it's a viral infection that primarily affects saliva producing, salivary glands that are located near your ears. Mumps can cause swelling in one or both of these glands. Mumps was common in the world until mumps vaccination became routine. Since then, the number of cases has dropped dramatically. However, mumps outbreaks still occur in different parts of the world, and the number of cases has crept up in recent years. These outbreaks generally affect people who are not vaccinated and occur in close contact settings such as schools or college campuses. Complications of mumps such as hearing loss are potentially serious but rare. There is no specific treatment for mumps. Uh, Earlier on this channel, I have already posted a short video about mumps. I hope you have seen that video, and today I am going to discuss this illness in detail. Well, first of all, let me tell you the symptoms. Well, some people infected with the mumps virus have either no signs or symptoms or very mild ones. When signs and symptoms do develop, they usually appear about 2 to 3 weeks after exposure to the virus. The primary sign of mumps is swollen salivary gland that cause the cheeks to puff out. Other signs and symptoms may include pain in the swollen salivary gland on one or both sides of your face, pain while chewing or swallowing, fever, headache, muscle aches, weakness and fatigue, loss of appetite. You should see your doctor if you or your child has signs and symptoms of mumps. Mumps is highly contagious for about 6 to 7 days after symptoms appear. Tell your doctor's office before you go in that you suspect mumps so arrangements can be made to avoid spreading the virus to others in the waiting room. In the meantime, rest as much as possible. Try to ease symptoms with cold compresses and over-the-counter pain relievers such as ibuprofen and acetaminophen. Mumps have become uncommon, so it is possible that another condition is causing your signs and symptoms. Swollen salivary glands and a fever could indicate a blocked salivary gland, a different viral infection. Now let me tell you the causes. Mumps is caused by a virus that spreads easily from person to person through infected saliva. If you are not immune, you can contract mumps by breathing in saliva droplets from an infected person who has just sneezed or coughed. You can also contract mumps from sharing utensils or cups with someone who has mumps. Now I'll tell you the complications. Complications of mumps are rare, but some are potentially serious. Most mumps complications involve inflammation and swelling in some parts of the body, such as testicles. This condition, known as orchitis, causes one or both testicles to swell in males who have reached puberty. Orchitis is painful, but it rarely leads to the inability to father a child. It rarely leads to sterility. Brain. Viral infections such as mumps can lead to inflammation of the brain that is known as encephalitis. Encephalitis can cause neurological problems and become life-threatening. Membranes and fluid around the membrane and spinal cord. This condition, known as meningitis, can occur if the mumps virus spreads through your bloodstream to infect your central nervous system. Pancreas. The signs and symptoms of this condition, known as pancreatitis, include pain in the upper abdomen, nausea, and vomiting. Well, earlier on this channel, I have already posted a video about pancreatitis that is very informative. You can see that video. Okay. There are some other complications of mumps that include hearing loss. Hearing loss can occur in one or both ears. Although rare, the hearing loss is sometimes permanent. Heart problems. Rarely, mumps have been associated with abnormal heartbeat and diseases of the heart muscle, and that is known as myocarditis. Miscarriage. Contracting mumps while you are pregnant, especially early in your pregnancy, may lead to miscarriage. Now I'll tell you some preventive measures. The best way to prevent mumps is to be vaccinated against the disease. Most people have immunity to mumps once they are fully vaccinated. The mumps vaccine is usually given as a combined measles, mumps, rubella inoculation, which contains the safest and most effective form of each vaccine. 2 doses of MMR vaccine are recommended before a child enters school. Those vaccines should be given when the child is between the ages of 12 and 15 months and between the ages of 4 and 6 years. College students, international travelers, and health care workers in particular are encouraged to make sure that they have 2 doses of MMR vaccine. A single dose is not completely effective at preventing mumps. A third dose of vaccine is not routinely recommended, but your doctor might recommend a third dose if you are in an area that is experiencing an outbreak. A study of a recent mumps outbreaks in a college campus showed that students who received a third dose of MMR vaccine had a much lower risk of contracting the disease. Okay, now I will tell you about the diagnosis of mumps. Well, uh, if you or your child has signs and symptoms of mumps, the doctor is likely to ask whether you or your child has been vaccinated against mumps and whether you might have been exposed to the virus. I recommend a blood test to check for evidence of the mumps virus. Now I'll tell you the treatment. Mumps is caused by a virus, so antibiotics are not effective, but most children and adults recover from an uncomplicated case of mumps within a few weeks. People with mumps are generally no longer contagious and can safely return to work or school about 5 days, usually 5 to 6 days after the appearance of the signs and symptoms. Now I'll tell you some lifestyle and home remedies. Rest is the best treatment. There is little your doctor can do to speed up recovery, but you can take some steps to ease pain and discomfort and keep others from being infected. Try to isolate yourself or your child to prevent spreading the disease to others. Someone with mumps may be contagious up to 5 days after the onset of signs and symptoms. Take over the counter pain relievers such as acetaminophen that comes with the name of Tylenol, uh, or a non-steroidal anti-inflammatory drug such as ibuprofen that comes with the name of Advil or Motrin to ease symptoms. Use a warm or cold compress to ease the pain of swollen glands. Wear an athletic sporter and use cold compresses to ease the pain of tender testicles. Avoid foods that require a lot of chewing. Try broth-based soups or soft foods such as mashed potatoes or oatmeal. Avoid sour foods such as citrus fruits or juices which stimulate saliva production. Drink plenty of fluids. And if your child has mumps, watch for complication. You should call your doctor if your child develops a fever of 103 Fahrenheit, 39 degrees C or greater, trouble eating or drinking, confusion or disorientation, abdominal pain in boys, pain and swelling of the testicles. In case of these serious complications or symptoms, you should contact your doctor as soon as possible. Okay, so this was my video about mumps. I hope you like this video. If you have any question about this illness, you can post your question in the comment sections. Thanks for watching this video. See you in next video. Bye for now.